Huntington's disease is a rare neurodegenerative disorder that is characterized by mood swings, sudden movements, and slurred speech. It is a progressive disease that solely impairs cognitive ability and motor impairment. Huntington's disease affects the brain as a whole. However, some regions are more sensitive to Huntington's than others. Throughout the time since HD was discovered, scientists have been working hard to find out more information about HD and how it progresses at the molecular level. It has been found that it is an autosomal dominant disorder, meaning that it is an inherited disease and the offspring has one copy of the mutant gene and one copy of a normal gene. When the mutant gene is expressed, Huntington's disease shows its effects generally by the age of 30. The common age to be diagnosed is between 30 and 40 years of age, but there's a certain type of Huntington's that's called juvenile Huntington's, which can rapidly progress and show its effects by the age of 20. Following the Huntington's chorea, uncontrollable movement, slow movement known as athetosis, and overall uncontrollable motor coordination in many regions of the body may be observed. In addition to those symptoms, patients may also experience mood disturbances such as inability to think clearly, confusion, and mood swings, as well as depression, dementia, and personality changes. Every individual experiences these symptoms differently, and therefore it's sometimes difficult to diagnose until multiple symptoms are present. It's estimated that 1 in every 100,000 people have Huntington's disease, and juvenile Huntington's disease accounts for approximately 16% of all cases. In the United States, there's an estimated 30,000 people with the disease. The prevalence has been determined to vary based upon an individual's race, geographical location, and the demographic differences as compared to other groups of people. In the 1990s, there was a study conducted showing that HD is more prevalent in Northern Europe, estimating that about 4 to 7 individuals in every 100,000 were affected. At this time, 3 individuals in 1 million were diagnosed with Huntington's disease in the U.S. each year. However, these estimations were done before the discovery of the genetic mutation associated with the disease.
HD affects the brain as a whole, however, some regions are more sensitive to HD than others. Majority of HD effects are seen in the basal ganglia in groups of cell clusters called nuclei. This region is directly involved in movement and behavior control and eventually leads to affective, cognitive, behavioral, and motor decline. The normal version of the gene Huntington contains around 10 to 35 CAG codon repeats. The mutated protein contains greater than 35 CAG repeats. CAG codes for the amino acid glutamine, so each repeated CAG codon creates another glutamine amino acid. The additional glutamines form a fragmented, misfolded protein that is toxic to nerve cells. The specific way in which these extra glutamines cause HD symptoms is not yet known, but there are specific characteristics of HD that can give us an explanation. The mutated protein aggregates within neuronal cells of the caudate and putamen that make up the dorsal striatum portion of the basal ganglia, causing neuronal cell death. This could be due to excitotoxicity, which is excessive signaling of these neurons causing a buildup of Ca2+ ions inside cells. If enough neurons in the caudate and putamen die, the brain tissue can begin to die off, decreasing the brain volume in that area and expanding the lateral ventricles. The caudate and putamen are directly involved with movement and motor control, so loss of these neurons causes involuntary movement that cannot be consciously suppressed.
The Huntington gene codes for the Huntington protein, but the biological significance of the protein remains unknown today. But we do know that a mutation, or a change, within the gene can change the function of the Huntington protein, which results in Huntington's disease. Not all changes in the gene cause Huntington's disease, which gives us non-HD alleles and HD alleles. HD alleles are alleles whose mutation changes the function of the Huntington gene, which causes Huntington's disease. And non-HD alleles are alleles of the Huntington gene whose mutations do not change the function of the Huntington gene and therefore do not cause Huntington's disease. A loss-of-function gene mutation that changes a non-HD allele to an HD allele is seen more frequently on chromosomes which contain a high number of CAG repeats. Individuals with CAG repeat lengths within a higher than normal frequency range between 35 to 40 repeats are more likely to develop the HD allele in their germ cells and therefore pass the mutant allele to their children. The highest risk for an individual to develop Huntington's disease is seen in a person whose parent has a higher than normal frequency of CAG repeats. The risk rate for Huntington's disease follows a paternal inheritance pattern, which means that an individual with a father who has a higher than normal frequency of CAG repeats is more prone to develop Huntington's disease than an individual with a mother who has a higher than normal frequency of CAG repeats. Other chromosomal features have contributed to the instability and expansion of CAG repeats within the population. Two of the molecular markers for Huntington's disease include 7 repeats of CCG codon next to the known CAG repeats, as well as a missing GAG codon found within the Huntington gene. Today, we know that the highest frequency for Huntington's disease is seen in Europe and countries of European descent, such as the United States and Australia. The lowest frequency for Huntington's disease is seen in the countries of Africa, China, Japan, and Finland. This is because Europeans have carried the HD allele and brought it wherever they settled, which is consistent with prevalence rates and frequency of Huntington's disease cases throughout these countries. There is no cure for Huntington's disease. However, many medications exist to lessen symptoms of movement and psychotic disorders, as well as other options to monitor and improve the quality of life for individuals living with Huntington's disease. Movement disorder medications include tetrabenazine, antipsychotic drugs haloperidol and chlorpromazine, amantadine, levetiracetam, and clonazepam. Nevertheless, all of these come with side effects which may worsen the disease or other psychiatric conditions for the individual. Psychiatric disorder medications include antidepressants, citalopram and escitalopram, antipsychotic drugs, quetiapine and risperidone, and mood-stabilizing drugs, valproate and carbamazepine. These medications have additional side effects as well, but do not worsen the condition of Huntington's disease for the individual. Additional treatment options include psychotherapy, speech therapy, physical therapy, or occupational therapy.